Good afternoon, Dr. Byron. For my site presentation, I went to visit Strive Physical Therapy. Strive Physical Therapy is located in Burlington, New Jersey, and I questioned Dr. Andrew Fernandez O'Brien, who he has a doctorate in physical therapy and is the clinical director at Strive Physical Therapy. I started off my questions with a very general question. I asked him what advice would he give to a student interested in entering the field. He urged me to get as much experience as I can. The more experience I have, the better it will look on my resume. Also, he advised me to volunteer at many different physical therapy sites to get a better understanding of the field. Each site may have a different field than another one may have, offering different lessons to learn. Also, he urged me to apply to become a physical therapy aide, which would allow me to see and work with physical therapists firsthand. Then I went on to ask him what his daily routine on the job is like. He said his day begins with scheduling appointments for patients and checking to see which patients are scheduled for the day. After about an hour after the day begins, they begin to see patients, each one set in 45-minute blocks, with about 10 minutes in between to get ready for the next following patient. Then I went on to ask him what kind of patients does he receive. He said the types of patients he receives varies from as young as 9 years old to 90 years old. He may see high school or younger athletes to as old as 90-year-old patients who are looking to get better functioning from on a day-to-day basis. Then I asked him what are some of the popular ailments that bring in patients. He said the top four that are most popular are shoulder pains, back pain, neck pain, and knee pain. Then I went on to ask him, how would you change your approach to treatment when dealing with an elderly patient or dealing with an athletic patient? He said his approach to each patient is relatively the same in regards that it is goal oriented. In the first appointment, he gets a feel for his patient and finds out what they want to get out of physical therapy. He could have a patient who is an athlete and would like to recover the strength and agility they had prior to their injury, or he could have an elderly patient who would just like to function better on a regular day basis without any pain. In my reaction to my site visit, it was great to visit and talk with trained professionals in the field to get a better understanding of the field. It gave me a direct look into what type of patients you will see on a daily basis. Also, it was great to talk with people who were in my shoes at one point in their life and to get advice on them on how to become ahead of the curve when the application process begins for me.